My name is Mark Henderson, and this is my photo story presentation on swine flu for Introduction to Journalism, 2009. I have special guest, Dr. Robert Hungerford, to tell us about the swine flu.
My name is Dr. Hungerford, and I'm one of the physicians working in the emergency department at John Hunter Hospital. I'll be talking about the emergence of swine flu and its impact worldwide and in the Hunter. Swine flu, or as it's otherwise known as H1N1 influenza A, was first detected in Mexico in April of this year and subsequently has been detected worldwide. The pandemic that began in March shows elements of two swine strains, one human strain and one avian strain of influenza. A typical feature of the newly emergent pandemic influenza strains is that severe infection occurs disproportionately in individuals who are not at the extremes of age. In contrast with seasonal influenza, what we have every year most likely occurs in children and elderly individuals. The influenza virus is present in the respiratory secretions of infected persons and can be transmitted through sneezing and coughing. Patients diagnosed as having swine flu are likely to be contagious from day one to the development of signs and symptoms until resolution of fever. However, because the duration of shedding of the virus has not been established, individuals should be considered contagious until 7 days after illness onset. The most common clinical findings with swine flu have been fever, cough, sore throat, general feelings of unwell, headache, vomiting and diarrhea. You can also get chills and muscle pains and joint pains, and the most people that are most predisposed to this illness are those with prior chronic lung disease such as asthma or COPD, immunosuppressive conditions, pregnancy, diabetes and obesity. 46 people with swine flu have died in New South Wales, and 3 of those have been in the Hunter Valley. The number of cases peaked in July and August, putting a strain on hospital beds, in particular emergency and intensive care units. However, the number of cases has now dropped. In regards to infection control, those who are in contact with people with swine flu should wear face masks, and those who have been diagnosed or at risk of having contracted the illness should be in isolation. For those requiring treatment, antivirals such as Tamiflu have proven to be effective against this virus. However, new antiviral agents are being currently developed. In summary, swine flu is similar to seasonal influenza in that it produces similar symptoms. However, it attacks a different proportion of the population. New vaccinations are being developed for those who are at risk. However, if you have a cough, cold or a fever that is persisting, you should see your general practitioner or go to your local emergency department.
Thank you, Doctor. So mask up, stay safe, and avoid the swine flu.